Hello everyone. So let's just talk about the microbiology, USMLE step 1, and this will continue about the bacteria, nocardia, and actinomyces, right? This nocardia and actinomyces, they both are the gram-positive, and they are like fungi, means they resemble fungi because they are long and branching filament type. So this see here, this is long and branching filament type. Again, this is long and branching filament type. So we can say that they both are resembling the fungi. Okay, now let's talk about the nocardia and actinomyces. See, nocardia is a aerobe catalytic positive. What does it mean by aerobe? See, aerobe means that it's required O2 for its proper development. Whereas actinomyces and aerobe means it doesn't require O2 and it is catalytic negative, just opposite the nocardia. One key feature here to note is that the nocardia is acid fast, means it is weak acid fast bacilli means bacteria, whereas actinomyces is non-acid fast. What does it even mean? See, the acid fast means this color. See, this color which is showing over here in acid fast. If acid fast is positive, this color will be bluish. But if acid fast is negative, this color will be pinkish. So that's why you can say nocardia is acid fast and the actinomyces is what it is the non-acid fast. Okay, it is not a acid fast. Okay. Now another key stuff that is nocardia, where we found this nocardia. See, this nocardia is often found in our soil. Okay, where? Yeah, often in our soil, right? Nocardia we found often in our soil, whereas actinomyces we found in our normal microbiota, for example, GIT microbiota, reproductive microbiota, and the oral microbiota, right? Now let's talk about the what are they exactly causing this nocardia. They lead to the pulmonary infection in immunocompromised patients. See, in this we see two scenarios. One is immunocompromised patient, but another is immunocompetent patient. Okay, so what does it mean? See, it simply means that immunocompromised patients are such patients whose immunity are weak and immunocomponent patients, immunocompromised immunity weak. Immunocomponent are those whose immunity is healthy and normal, right? So that is immunocomponent. Okay. Now, basically, in the immunocomponent, this nocardia lead to pulmonary infection, lung infection, and you feel like the patient is having TB, but it's actually this nocardia, so it can mimic the TB in immunocompromised patient. Okay. But there is a key feature that is very important key feature, that is PPD will be negative. Now, what does it even mean by this PPD? It will be negative, right? What does it mean that PPD will be negative? See, PPD is a purified protein derivative solution which we used in the TST test, that is tuberculin skin test for diagnosis of TB. So it will be present in case of TB, but if it's absent, that means that means there is no cardia. Okay, so that's what it means. Also, suppose a person got, how can we say, yeah, a person got any kind of trauma, okay, cutaneous trauma, skin trauma. Now, in immunocomponent individual, that means the patient is healthy and got some kind of trauma, and skin trauma, right? So it can spread from there to CNS and can lead to cerebral abscesses. Okay, can lead to what? Can lead to cerebral abscesses. One more thing is that from pulmonary infection can both lead to certain abscesses. But one more thing is that if there is any kind of trauma and the patient has healthy immune system, it can lead to certain kind of skin infection also. That's what it means. Right. Whereas if you talk about the actinomyces, the actinomyces is very like simple, right? So because this is present in our normal oral, reproductive, and GIT microbiota. Now, if related to reproductive, so for example, the patient who uses intrauterine devices, they can get the PID, that is pelvic inflammatory disease, from this actinomyces. Now, if we talk about oral, so for example, the oral and facial abscess, it's caused by this, often caused by this actinomyces, and these, what will do, these abscess, they will drain, for example, this is abscess, they will drain through various ways, and tract, okay, often like this happens with the, when we extract the tooth, means dental caries or extraction, or maybe some other maxillofacial trauma. So that can, lead to such abscesses. Right? Okay. And one key feature of it again is that it have these yellow sulfur granules. Very important. We have these actinomyces have what it has yellow sulfur granules. Okay, yellow sulfur granules. Okay, now let's talk about the treatment part. Okay, if we talk about the treatment, we can treat it with what? We can treat it with sulfonamide, right? What? Nocardia. Nocardia we can treat by the sulfonamide, whereas actinomyces we can treat by penicillin. It's very easy. Nocardia, again repeat with me, it's being treated by the sulfonamide, right? And the actinomyces is going to treat it by the penicillin. Now, one mnemonic to remember over here is that SNAP sulfonamide. Now, what does it even mean by SNAP? It's not a meaning, it's just a mnemonic. C, S for sulfonamide and for nocardia, A for actinomyces, and P for penicillin. That means we can say that this, sulfonamide is for what? Let me write like that. S and A P, that is sulfonamide is for nocardia, whereas the actinomyces is penicillin. Just for, understanding, this is a mnemonic. We can say that sulfonamide treatment like sulfonamide is the treatment of nocardia and actinomyces is treatment of penicillin. That's what we mean by the snap over here. Right. What else is there? So you have seen this carefully this nocardia and this one is actinomyces, right? We have seen it carefully. One is acid fast, one is not acid fast. Okay. Hope you guys like it. If you really like my videos, then please do subscribe my channel. I would love to make more such videos. Thank you for your time.